And I'd now like to introduce Professor Sue Berney, who's been the manager of physiotherapy at Austin Health since 2014. She's worked in the acute care setting in tertiary healthcare for more than 30 years in Australia and internationally. And she's active in research herself. So she's a manager, leader, and a researcher. And in 2015, her department was recognised with the Premier's Award for Excellence for supporting a redesign of the acute hospital workforce. So I'm sure we're all really looking forward to that. And thank you, Sue.
Thank you, Kathy, and thank you also for the Academy for allowing me to come and speak with you today. And I'm hoping you can see the slides. So this afternoon, I thought I would speak to a number of strategies that we've initiated here in the physiotherapy department to try and build and grow research. And I hope some or any of it might be useful for other people in the audience. The first thing I think that is really super important is to have a productive partnership with the university. And by that, I mean creating an academic environment within the department, which includes taking of students. So we take physiotherapy students from 2 universities and have relationships with both universities that are important to the business that we do in the department every day. We also look for opportunities for co-supervision of research higher degree students from our staff, either on an academic level or as a clinician who is a supervisor because of their clinical activity. We also recruit for academic excellence, so what I mean by that is that we actively recruit new graduates who have an interest in completing a research higher degree and also have the marks to successfully apply for a PhD scholarship, with the aim that the candidates remain in the physiotherapy department during their studies, so other clinicians can directly observe research practice and also contribute to the candidates' research process. And what we get from that as a department is that the PhD candidate sets an important example to the clinicians about a potential research career. And they can act as future mentors for our staff and also assist staff in what Nick was talking about earlier, which is framing a question, a clinical question, so that you can actually get an answer. For the PhD candidate, it enables them to maintain clinical practice, and that's often dictated by in accordance with the PhD award that they've got. So they might be able to work 1 or 2 days per week. The department wins from that because the candidates are often interested in higher paid work, which is often weekend work, which other people aren't as interested in if you work as a full-time member of staff. We also, one of the things that we have made an active decision to do, which is to set expectations that research is a part of what we do every day. We have it embedded in our in every agenda meeting within the department. There is an agenda item about research, and also in people's performance review and development framework, and in their supervision. We have also made research one of the 3 key pillars within our department, along with education and a positive learning culture. And the value proposition for the staff in this is that what we believe in these 3 areas which research contributes to is taking care from being adequate to excellent. And so it's seen as and the whole department works on this together, and it's seen as being a very important piece of work that we all do together. We also, I think it's important to leverage your university relationships and gain organisational support for a funded research position. And I think once you get those types of positions, your research outputs can really exponentially grow. We were able to obtain funding for a professor of physiotherapy that was half funded from the department and half funded from the university. And the position is employed by the university, but sits most importantly in the hospital. And it's been pivotal to the success. It's enabled us to put research frameworks around quality improvement or clinical questions. And we're now much better at applying that framework at the right time, either at the beginning of a project or when feasibility has been established. And I think one of the important things is that the professor of physiotherapy works very differently to me. We sit in different meetings, but between the two of us, we're able to identify and leverage opportunities where we can partner and grow research within the department. We meet regularly, and I think that's an important part in maintaining the productivity around the professor position. We also have a rotation, a junior rotation that exposes staff to research. This rotation goes for 8 months, where a junior member of staff who has a potential interest in completing a research higher degree is exposed to all areas of research, from ethics applications through to collecting data and writing a manuscript. And the aim of the rotation is that each staff member gets a first author publication that assists them in the pursuit of research higher degree funding. And lastly, what we do that I think is also important is that we celebrate and recognise success. So we have an annual research symposium. We have a lecture from a prominent researcher, and we also give recognition at that time for people who have published throughout the year or completed their PhDs. And we award a prize of $500 to the staff member who has contributed to the successful research activity over the previous year. We also have publications, and prizes are recognised in our weekly newsletter. And these strategies all working together, I think, have been really critical to building a research culture within our department. And we're by no means where we want to be. We've still got a lot of work to do in our research pillar, but I think we've made important strides. And I think one of the things it was critical was in achieving an acute workforce redesign was that we were very much tied to evidence-based practice and taking our workforce to where the evidence lay. And I think that was an important part for us in being successful. So I'll stop sharing now and go back to Kathy.
Fabulous, Sue. Thank you so much. I reckon you'll be inundated with people applying for jobs with you, you and Anne-Marie. So thank you so much. It's, I'm hoping there's a lot of people registered to do this for this seminar, and I'm hoping some of them are managers in clinical environments, managers and leaders who can use some of these strategies. So many questions to ask you.